The title of this study is the MOSAIC study, a mixed methods study of the clinical, emotional, and financial burden of geographic atrophy among patients and caregivers in the United States. Hello, I'm Dr. Sophie Bakri from the Mayo Clinic in Rochester, Minnesota. On behalf of my co-authors, I am pleased to share the results of the MOSAIC study in the United States. MOSAIC was a collaborative burden of illness study sponsored by Apellis Pharmaceuticals that involved patient groups and retina specialists worldwide to evaluate clinical, emotional, and financial burden of geographic atrophy, or GA, on patients and their caregivers. In this study, 102 patients and 102 primary caregivers from the United States were interviewed. Interviews focused on changes to vision, the impact of GA on patients and caregivers' lives, the types of support provided to patients, and the impact this support had on the caregiver's own life. The patients were aged 60 years or older and had GA secondary to age-related macular degeneration in at least one eye. Caregivers were individuals aged 18 years or older who identified as primary caregivers. On average, patients in the study were 68 years old, with 77% of them being retired and 88% reporting living with a partner or spouse, family member, or friend. Primary caregivers were younger, with a mean age of 46 years. Over 50% of them reported not being able to work because of the need to care for a person with GA. 29% of caregivers reported working fewer hours. A total of 81% of caregivers lived with the person they cared for. Due to vision loss, 86% of patients did not drive. For the patients who still drove, driving difficulty increased at night and in challenging driving conditions. Patients also reported that their ability to perform everyday activities was negatively impacted. This negative impact on patient mobility directly contributed to caregiver burden. Over 70% of caregivers reported driving patients to their medical appointments, shopping for patients, and accompanying patients when they were walking. GA also had a significant emotional impact on both patients and their caregivers. For patients, the loss of independence and worry about vision loss significantly impacted their emotional well-being. This manifested as feelings of frustration reported by almost 50% of patients and fear of embarrassment due to loss of independence. The emotional well-being of primary caregivers was primarily affected by fear of what the future held for the person they cared for. Both patients and caregivers reported spending their own money to purchase assistive devices and needing to make changes in employment status, which negatively impacted their financial status. There was a clear association between poor vision-related quality of life of patients with GA and high caregiver burden. In summary, this study provides evidence that GA significantly impacts patient independence and mental health with a deep ripple effect on caregivers. These findings call for a broader understanding of the multifaceted burden of GA and an integrated approach in our medical practices to better support the entire GA community.